looked up a lot of things.
I know. No, first of all, I would like to ask you both permission to use this video for educational purpose and on internet. Do I have your permission?
Yes, you do.
Do I as well have your permission?
Yes.
Okay.
Yes.
So, tell me about your symptoms. What's bothering you?
I have had severe pain down my left leg to the knee, and then just a little, maybe 5 inches beyond the knee. And it was to the point where I could not turn. I couldn't get up out of a chair.
Okay, how long have you had that pain?
I guess it's all about 8 months.
8 months is getting really bad. Huh?
And it was getting really bad. And then something changed, because all of a sudden I could step on my leg and it did not hurt.
But is it still livable?
It is now livable,
It's not livable. And
but it wasn't.
Yeah.
And now I have a burning sensation and pinching on the right leg.
yes. And that all of that comes from of two of your discs pushing on the nerve.
Okay.
And
Yeah.
narrowing in the spine. And I'm going to just jump to the point that you have been offered surgery elsewhere. Now, without
Yes.
calling any names, you have been offered surgery. And tell me, what did they offer you? What kind of surgery did they offer
They
you?
offered me it would be 7.5 hours, and they would open up my back, and it would be about a 10-inch incision, and they would go in and put plates and screws on every one of the discs.
Mm-hmm.
And then on my S1, they were going to put on little metal plates because of the scoliosis. They were going to put on plates and attach it to my pelvic bone.
And it's more than that. You are already scheduled to get that surgery done.
Yes, I am already scheduled, but
In how many
Yeah.
weeks are you scheduled to get that surgery done?
in about 1 month.
1 month. So why are you
Yes.
coming to me?
I am coming to you because I'm looking for a less invasive surgery. I do not want 7.5 hours of surgery. I do not want to be cut open that far. I do not want that much recuperation time, and the infection rate
Yeah.
was much larger. The chance of needing a blood
Blood infusion.
infusion would be much longer.
And the success rate was only 85 to 90.
Yes, and the success rate was 75 to 85%.
Yeah,
I think is what
yeah.
they said. And that in time I would have to come in and get more done, because it tears or wears on the
Other
ones
levels.
above it.
Yeah.
So
So what assures you, or how do you know that I can do better job than that? What made you decision to come and see me?
we have talked to a great deal of people.
Who in the last few years I have done this surgery for, correct?
Yes, you have done it for them, and they
No
have
names,
heard
but
about you.
yeah, no names. But tell me about those patients I have done surgery for. What did they tell you?
They said that they would never go through what I have been suggested to go through. That, oh no, it's just not feasible. All the plates and screws were a Band-Aid, and you need to go in and see Dr. Abbasi, because he would be able to fix what you have, and you wouldn't go through 1/10 of the problems that you're going to have.
And that is as well a statistic. You know, in our surgery, I do that surgery that was suggested to you in 7.5 hours. We do it in about 1 to 1.5 hours.
Yeah.
Our blood loss is 1/10 of the open surgery.
Yeah.
Our risk of infection is 1/15 to 1/30th of the open surgery. That is the statistic that we
Yeah.
have published. Our hospital stay is 1/3 of the open surgery. And in my patient usually walk within a few hours after the surgery, and 96% of them are discharged within the first 24 hours. Usually within 2 to 4 weeks are back to basic daily activity, and within 3 to 6 months, usually bone grows enough for us to reduce the limitation. And this is a statistic based on 10 years of data that we have collected on 1,500 patients.
Well,
Open surgery, double, triple, quadruple those numbers. So they didn't lie to you, and
No,
they're a good
not at
surgeon.
all.
They,
the one gal got walking right away, and the one gal that was
Bedridden for 6 years.
after
She's
open
now
surgery,
out
No,
after
you did.
your surgery. She
She's
was
mowing the yard.
bedridden for 6 years, and she's now out mowing lawn.
so she was bedridden for 6 years. I did the surgery, and she started walking and recovered.
Recovered
we-
very well, and
yeah.
now she's out mowing lawn.
And you know, we have that track record, multiple time that track record, and we have over 1,000 patient testimonials out there on YouTube. And I put always average. I don't always choose. You cannot have
Yeah.
1,200 best results
No.
because if 1,200 best results are out there, that speak for itself.
Yes.
And I
Oh,
have
very
over
much so.
1,200. Now I'm happy you came, and we are going to start the process. And but so I'm hearing that you're going to cancel that surgery.
Oh, yes.
Oh yes.
Oh, yes.
To come with us. So that
Yes.
makes me very happy that I can help. And thank you very much for these testimonials. I think in 2023 there's lots of information patient can acquire, get before they make an important decision like that.
Yeah.
Thank you being part of that.
We have done a lot of research.
Excellent. Well, thank
Yes.
Those are always my best patient who are well researched. And from your background, what is your background?
We are both teachers.
Educators.
Yes.
That is I think what makes it different. Educators, they know how to educate themselves, and those are my best patients. Okay? Well, thank you for this interview. I appreciate that.
Thank you.
Okay.
Thank you.